Hi, I'm Michelle Kittleson, professor of medicine at the Smith Heart Institute, Cedars-Sinai in Los Angeles, and associate editor for JACC. I'm delighted to be joined today by Dr. Eric Hall to discuss his manuscript, Cognitive Function and Patient-Reported Outcomes After Cardiogenic Shock. This study will be presented at the American College of Cardiology annual meeting with simultaneous publication in JACC. Dr. Hall is a cardiology fellow at UT Southwestern Medical Center in Dallas, and I'm so excited to discuss this exciting manuscript with him. I'll give you a quick overview. In this single-center prospective study, Dr. Hall and colleagues addressed a critical question that plagues all cardiologists. Do patients who survive cardiogenic shock have neurocognitive consequences at intermediate-term follow-up? They examined 118 cardiogenic shock survivors from 2 hospitals and assessed the Montreal Cognitive Assessment Blind at discharge and 3 months later. What did they find? Soberingly, 74% of patients met criteria for cognitive impairment at discharge, with most demonstrating mild impairment. Almost 2/3 still had scores consistent with cognitive impairment at 3 months. And for those for whom there was assessment of pre-admission cognitive function from relatives and informants, 3/4 had no evidence of precognitive impairment. I'd like to focus on the implications of these observations for clinical care as well as future trials. First, Dr. Hall, Eric, congratulations on this really outstanding study that addresses such an important question for clinicians. Tell me, how do you think these results might assist clinicians in caring for patients who survive cardiogenic shock?
Well, thank you very much, Dr. Kittleson. Thank you very much for the opportunity to speak with you about our paper. I think our results suggest that brain injury is potentially an overlooked aspect of cardiogenic shock, and that patients are, suffering neurological injury over the course of an admission with cardiogenic shock that then persists at least through 3-month follow-up. We also saw in our study that patients with lower cognitive testing scores at 3 months had increased odds of disability, as defined by a modified Rankin scale, and worse health-related quality of life. So I think this suggests that these factors are correlated through at least intermediate-term follow-up. I think for us as clinicians, it means we should be considering that things outside of the heart, that our patients have been affected in more ways than just their cardiac function, than just their EF after experiencing cardiogenic shock. I think we'll need more research going forward to better understand how we should screen for cognitive impairment and how we should manage these patients. But I think, at least at this stage, it suggests that we need to think a little bit more holistically about our patients, both when we're discharging them and when we're seeing them in clinic after they've survived cardiogenic shock.
I love that answer. I think it's so important as we enter the hyper specialized world of medicine to remember the whole patient. And I think it's so useful for clinicians, particularly when you're managing expectations of patients and their families, to say, listen, we have this beautiful study out of UT Southwestern by Dr. Eric Hall. I mean, you might not cite that to the patient, but you could, to say it is normal to feel this cognitive impairment. You're not alone. And then in a few years, we'll also be able to tell our patients maybe what we could do with this information. So tell me, what future clinical trials do you think should be performed to better understand and potentially improve the outcomes of our patients, our cardiogenic shock survivors?
Yeah, so I think that's a great question. And I think there's a lot of work that still remains for us to do. Right now, we're planning a study that will look at long-term cognitive function and health-related quality of life, functional status through 1 year among patients who survive cardiogenic shock to get a better sense of what the long-term recovery trajectory is. I think so that's sort of the post-discharge side. I think we also need to better understand the mechanisms, better understand what's happening to patients' brains while they're in the ICU with cardiogenic shock and also after they leave the hospital. So then we can begin to develop strategies to protect patients' brains and improve their function not only at time of discharge, but hopefully continuing long after they leave the hospital also.
Amazing. So you've defined the problem. Now you want to understand the mechanism behind the problem and how interventions could help. I think the future is bright for these patients. We've gotten to the point where science can save their lives, and now we're going to make sure their lives are better. Thanks so much for taking the time to discuss this, and congratulations on your ACC presentation and simultaneous publication in JACC.
Oh, well, thank you very much. Really appreciate the chance to speak with you and all your help through the process.
Thank you.